Report. Okay. Miss Shirley, is yours recording?
It said it was recording.
Yeah, automatic.
Yes,
Okay. Um, okay, that's fine. So it goes to you or me?
It should go to
should
you,
go to
I
you.
believe.
Okay.
And you'll see it's recording the top left side, on the top left-hand side of your screen. You should see a little recording icon, I believe. I see it on my screen at
Okay, you
least.
do see it? Okay, I have
Yeah.
a few monitors up, so I can't.
Oh, okay. Yeah.
Right, no, okay, so that's perfect. Okay, so well, that's good. So it's already recording. So you guys definitely welcome to the Health Committee meeting. This is our monthly meeting. Typically it's on Tuesday, but today it's on Wednesday. And my name is Tasha. I am the Health Executive Chair. So I definitely appreciate you guys and welcome you guys for coming. Today we do have guest speakers, which I will get into in a moment. Going to, and you guys, I may stop talking here and there because I'm still letting people in. To discuss Medicare, and a lot of things that reside in Medicare in 2005 and different things. I'm sorry. Okay. So before we get into that, just want to let you guys know about upcoming events for NAACP for our DeKalb branch. Right now, the only one that I do have that I know of, and please, if anybody else know, you can speak on any events that is happening. We have our annual Martin Luther King Parade. It is January 18th, and what's so awesome about this parade for next year, it will be in Stonecrest. This is the first time we're doing it in Stonecrest, so we're very excited. If you can attend, that would be great. Please share. And I'm gonna put in the chat a flyer so you can have. And if anyone want to volunteer, to help with the parade, please let me know as well. Because we, all hands on deck to make this such a great experience. So again, our Martin Luther King Parade is coming up January 18th. The start time will be 10 a.m. and it will be in Stonecrest. 1 second. All right. So as far as if you look at the agenda, and I'm sorry, can everyone see the agenda?
Yes.
Okay,
Yes.
awesome. Okay, so as far as for the housekeeping for our presenters, we just want to make sure that everyone is muted. Please just make sure you're muted while the presentation is going on. And also we're going to hold all questions until the end. That way they can go through their whole presentation, and a lot of times questions that you may have will be answered throughout the presentation. So please keep questions to the end, but feel free to put the questions in the chat. So when it comes to the Q&A session, I can let them know the questions that are being asked in the chat. But as far as for the housekeeping, that is about the only thing. So if you see an agenda, just a timeline of what this is going to look like. And now I will introduce our speakers who will be discussing everything today. 1 second. Oh, I just had it up. That's not it. Okay. Oh, here we go. Great. All right. So our first speaker is going to be Nathan. He is a senior Medicare patrol. Nathan has served as an outreach specialist for federal funded senior medical patrol program in the state of Georgia. where he and his team seek to empower Medicare beneficiaries, fight that over $6 billion in Medicare fraud. So he will be going briefly over the fraud for Medicare. And then next we will have Miss Shirley. She is a Georgia SHIP counselor. She in Georgia SHIP is State Health Insurance Assistant Program. And she has been with this program for a total of 14 years. So those are our presenters, and I will turn it over to them. So
Well, thank you, Ms. Tasha, and thank you to Tasha and Shirley for inviting me to participate today. That was something they had going on originally, but I was invited to be a little opening act for Shirley today, talking about the Senior Medicare Patrol Program, trying to fight fraud in the Medicare system. I'm trying to share my screen. I'm getting that host disabled participant screen sharing button when I try to share the screen.
okay.
Shirley, do you know what you hit during our test run that allowed you to be able to share your screen?
I had a green share button and I
That's
was
what I had.
allowed to do that.
That's what I had too. It says host disabled participant screen sharing.
Okay, so this is on me. Okay.
Yes.
All right. So let me see.
Maybe something in your settings that would allow participants to share their screen.
Yeah, I'm using the same code. Give me 1 second. I didn't change anything. Okay.
Right. Yeah, let me try it again here.
Okay. It should allow.
Aha, now we're, yep, now it's going.
Awesome.
Okay, let me know if you can share my screen, see my screen here.
Yes.
Fantastic. So I'm going to give the majority of the time to Shirley today, but I want to tell you a little bit about some common scams in the Medicare system. Again, as Tasha said during my introduction, Medicare fraud's a $60 billion a year problem with a B nationwide, and we're trying to take a bite out of that. And to do that, we need the help of the community. We're a nonprofit program funded by our tax dollars. We're the sister program to Shirley's program you'll hear from after I'm done speaking. If you like what we have to say and you are looking for a speaker from some other type of group you might have in Georgia, could be a church group or a ladies club, anywhere older adults that are caregivers might be, we would love to hear from you and send somebody out either virtually like I'm doing today or in person. So some common examples of Medicare fraud: billing for services or supplies that were not provided, misrepresenting a diagnosis or other information to justify payment, providing unsolicited supplies to beneficiaries, and prescribing or providing excessive or unnecessary medical testing. I'm going to run through some of the most common scams we're seeing in the state of Georgia currently regarding Medicare. Durable medical equipment scams. So scams tend to come and go in Medicare. They're very hot for a while, then something happens and they're no longer quite as prevalent. But in my 6.5 years at this particular job, this has been a very consistent scam that we've seen the entire time. DME stands for durable medical equipment and includes things like knee braces and back braces. You receive phone calls from scammers claiming to be from things like senior benefits, offering free medical equipment. We always say if it's actually free, then you will not need to provide your Medicare number. Free can be a loaded term. Often when this word free is used, they mean, what's your Medicare number? We're going to bill your Medicare for that service or device. We really want you talking to your own physician about your needs for anything medical related. We don't want you accepting those offers over the phone. We want you making sure you're getting things that are medically necessary and also appropriate for you. This happens a lot with back braces and knee braces. You get a phone call, the person says they're from senior benefits and they know you have back pain and they can get you a back brace and you might accept that offer, but typically the back brace you might receive would not be one that's medically appropriate. It might be too big, it might be too small. We really want you having your own doctor being the one making that decision. Urinary catheter scams. This is the opposite. This is a scam we had not really been dealing with up until 2024. But sometime around spring, nationwide, including Georgia, this scam blew up. How the scam works: regardless of medical need, disreputable companies bill Medicare for urinary catheters. Catheters may or may not actually be sent to the Medicare beneficiary. How we can fight back, and this is one of your best fraud fighting tools you have, is reviewing your explanation of benefits or Medicare summary notices. I'm sure in this call, some of y'all might be on Medicare. Some of y'all might not be there yet. Some of y'all might have family members or friends that are on Medicare. So even if you're not on Medicare, maybe you're taking care of mom or dad, give them a little bit of help them check those EOBs and MSNs, not just for urinary catheters they're not receiving, they don't need, but for any suspicious charges that seemed like things that weren't actually occurring, medical equipment they didn't order, or even medical services they didn't receive. Be suspicious of any unsolicited offers for free medical equipment, including urinary catheters. And again, please talk to your own doctor about these needs. New Medicare card scams. This one has also been pretty persistent for the entire 6 years I've been at this position. Scammers call impersonating Medicare to state you will be receiving a new Medicare card, and they must verify your info. A lot of times they'll say it'll be a plastic Medicare card. If any of y'all are familiar with the red, white, and blue cards, like the one on the screen, you'll know it's made out of paper. It gets frayed very easily, tears very easily, coming in and out of your purse or wallet. So scammers know that. So they say, hey, what if we tell people we're sending a new plastic card out? Or I've also heard these scammers say it's going to have a chip in it, like how your credit cards have chips in them now. Keep in mind, Medicare will never call and ask you for your Medicare number. We used to say Medicare will never call you. That's still almost true. It's like 98% true, but there's a couple of exceptions that are fairly rare. So I can't say they'll never call you, but if they ever call you, they will never ask for your Medicare number. And the vast majority of the phone calls you're getting, and it's someone claiming to be from Medicare, it is a scam. So if someone says they're from Medicare and they call you, I want you to be immediately skeptical. If you receive a call from someone asking you to verify your Medicare or Social Security number information, please hang up the phone immediately. And keep in mind, these phone calls, they usually will be very clever. They will call you from an area code that's local to your phone's area code, but it doesn't mean they're calling you from somewhere in the area. They could call them anywhere in the world. They kind of use those local area codes to lure you into a false sense of security, thinking you're more likely to answer the phone. Report fraud, errors, and abuse. So our little slogan, SMP, is prevent, detect, and report. We want you to prevent the fraud from happening to begin with if possible. If it does happen, we want you to detect that fraud. And if you detect it, we want you to call and report it. Who do you call to report that to? We want you to call us at SMP hotline number. Remember, if you receive a suspicious call, hang up immediately. Sometimes it's not a scam necessarily. It might be something that was a mistake. If it's a trusted doctor's office you go to a lot, they're not necessarily trying to scam you. It might be something that was an oversight or an error on their end. We encourage you to call your provider or plan first, and maybe it might be something they can resolve. However, if you do suspect fraud, and maybe that you tried calling the doctor's office and they didn't give you an answer you thought was satisfactory, or maybe you're seeing on that Medicare summary notice, you don't know what doctor that is, and you don't know where it came from. You don't know who to call. Call us. Our 877-272-8720 hotline number. You see that number on your screen. I hope you keep that handy. Monday through Friday from 9 to 5, we have a live person answer our phone. So they're very easy to get a hold of. Maybe you're not even sure if it's a scam. You don't know if it's fraud. You're kind of suspicious. Give that number a call anyways. It's also a great number to call if you want to request a presentation from us. Today, you're getting kind of my more brief presentation, but in person, I can go into some more details on a lot of these scams and fraud that are occurring. The last scam I'll talk about before I turn it over to Shirley, it transitions over to her pretty well, Medicare enrollment scams. As many as you know, the Medicare open enrollment period has just ended for 2025. But there are always new special enrollment periods opening up too, that Shirley will talk about. And Medicare enrollment time is when scammers with Medicare tend to turn up the notch a little bit and scam even more. Beneficiaries may receive a phone call or otherwise approached about switching your Medicare plan. These people contacting you about switching your plan may not have your best interest in mind and may switch you into a plan not appropriate for your finances or medical needs. How you can fight back against these scams is talk to a trusted resource. when making any switches to your Medicare plan. One of the most trusted resources out there, and the one we always refer to, is the SHIP program, the State Health Insurance Assistance Program. They have a hotline number there. You see the 1-866-552-4464 option 4. That's a statewide hotline number. If you have family or friends not in Georgia, S&P and SHIP exist in all 50 states. The number you call would be different depending on what state they're in. But to find your local, for that particular state SHIP program, there's also the website shiphelp.org. But for your benefit, in your cases, if you're in Georgia, we actually have a SHIP counselor for the Atlanta metro area in the call today, Miss Shirley Thomas. And I'm going to hand things over to her, stop sharing my screen. And I appreciate your time, and I welcome any questions you might have at the end of the presentation.
Thank you so much. Thank you, Nathan. If you have a Medicare and You book, or your family member has a Medicare and You book, on the back cover is the name and the phone number for SHIP. We are trained by Medicare to provide information and assistance. And like Nathan said, there is a lot. There's a lot going on with trying to share my, there we go. There's a lot going on with Medicare this year because, no, this is in the way. Okay. Because the administration was trying to get some things passed before. I'm going to hopefully be able to explain. Okay. Wait, I want to.
Shirley, you muted yourself, I think.
Yeah, I muted myself because there's a recording in the background from when I was speaking before. But anyway, SHIP, the Atlanta SHIP can be found in Cherokee, Clayton, Cobb, DeKalb, Douglas, Fayette, Fulton, Gwinnett, Henry, and Rockdale. So as Nathan was saying, wherever there is Medicare, there is a SHIP and S&P office. So it's all 50 states, Puerto Rico, Guam, and the Virgin Islands. Okay. So I'm sorry about that in the background. In order to get Medicare, you need to be 65 or older or disabled. Persons with ALS or end-stage renal disease do not have to wait the 24 months before their Medicare starts. If you get Social Security payments, the money comes from your Social Security check and goes to CMS, or the Center for Medicare and Medicaid Services. Or if you're receiving railroad retirement benefits, the money comes from there, goes to CMS, and that's how it pays for Medicare. There are 2 ways to enroll in Medicare. I'm going really fast. 2 ways to enroll in Medicare. Option 1 is to enroll in Part A and B. That's the red, white, and blue card. The Part A is usually free if you have worked at least 10 years. If you have worked less than 10 years, Part A will cost $285 if you've worked for 7.5 years and more, or it will cost $505 if you've worked less than 7.5 years. Now, yet next year, that is going up to $518 per month just for Part A. And then the Part B is the medical insurance. That premium, it is $174.70 this year. It is going up to $185. The Part A has a deductible of $1,632. So once you're admitted to the hospital, you'll be charged $1,632, and then the bill accrues from there. But next year, it's going up to $1,676. The Part B has a deductible. It is an annual deductible of $240. Next year, it is going up to $257. Now, the Part A pays for semi-private rooms, meals, general nursing, the medications you receive in the hospital, and other hospital services and supplies. You must have a full 3-day inpatient stay in order for Part A to pay for the first 20 days of rehab or skilled nursing care. It also pays for blood if you're inpatient. It will pay for hospice care, home health care, and for certain inpatient, non-religious, non-medical health care and approved religious non-medical institutions. It will not pay for private duty nursing, your phone, your television, or personal care items. Part B is for doctor services. So that's going to the doctor. It will pay for outpatient medical and surgical supplies and services. It pays for clinical lab tests. It pays for durable medical equipment, and that includes small things like a sling. It pays for diabetic testing supplies. It pays for preventative services. And this year, all of the shots that were recommended by the ACIP will be free. That is flu, pneumonia, RSV, and shingles. And it pays for home health care. Now, the preventative services, there are a lot of preventative services, and I'm not going to go over them because we really don't have time. But the Welcome to Medicare visit, when you first enroll in Medicare, you're entitled to a Welcome to Medicare visit. When you make that appointment, tell the receptionist that this is your Welcome to Medicare visit, and they will review your medical and social history and review tasks and risks, moods, your weight. So basically what they're doing is data gathering so they know what to look for the rest of the year. Okay, then the yearly wellness visit, that is different. At least 12 months after you have been enrolled in full Medicare, after you have had your Welcome to Medicare visit, you're entitled to a yearly wellness visit. Again, you must tell the receptionist that this is your yearly visit, so it will be free. Now, if you have something like a colonoscopy, you cannot have these services done where if they find a polyp, they clip the polyp, and then you go and speak with your doctor, because then that becomes a procedure and a medical visit. So to have it free, they have to do the test, review what they found in the Welcome to Medicare visit, and not do services. For Medigap, you have A and B, the red, white, and blue card, and then optional is Part D for prescriptions, or the Medigap that's on the left, the supplemental. It will pay the 20% that Medicare does not cover. It is sold by private insurance companies, and it just pays for co-insurances, co-pays, and deductibles. It does not drive anything. It only follows after Medicare has approved and paid their 80%. Then the Medigap will pay the 20%. They're standardized. So the letters are from A to N, and whatever it says policy A or policy G or policy K will pay, that's what they have to pay. But since they're run by private insurance companies, they will charge you different. So the premiums are different. If you were not 65 in 2020, you cannot purchase policies C and F any longer. And I suggest that if you are not sure whether or not you want a Medigap, you need to research it, because that is something that you want to enroll in and keep for the duration. Then there is Part D for the prescriptions. There have been a lot of changes with Part D this year, but Part D is for the prescriptions. And even if you don't take medications, you should enroll in a Part D plan, because if you do get a prescription later on in life, you will be charged a late enrollment penalty that is for the duration of your time with Medicare. And of course, the slide says it's optional and you could choose to join or not. And you may have to pay a lifetime penalty. You definitely will have to pay a lifetime penalty. And there are no exceptions to that. So yes, and you check the plan to make sure that all of your medications are in formulary and how much you have to pay out of pocket for your medications. Now, the Inflation Reduction Act has capped the medications, what you pay for medications, at $2,000 this year. It has been that people have paid $8,000 or more for their medication in any given year. Now the costs have been capped to $2,000. And insulin has been made available for $35 or less. And if you are low income, about $2,200 per month, then you would qualify for extra help, which is also called LIS. And extra help will help you discount and help you pay for your medications. Okay. One of the new changes this year is the prescription payment plan. So instead of you going and paying for the medications, now the insurance company will give the pharmacy the $2,000. They will give you a card. You will take that card to the pharmacy and the pharmacy will subtract the amount off that card. What you'll be doing is paying the insurance company back. So however much the $2,000 is there, however much your medications cost, they should subtract that from the $2,000. The balance is then divided by 11 months the next month, and so forth. If you do decide to opt into that program, then please do the math and make sure that they are doing the math correctly. The persons that receive extra help or on the program for LIS, most of the time, this program does not work for you, and just being on extra help is better than being in the payment plan. And the payment plan usually works best for persons that have very extremely expensive medications that they have to take. Okay. Now, CMS has revised the special enrollment period for persons with Medicaid and extra help. So instead of being able to change your plans quarterly, starting in 2025, you will be able to change your prescription drug plan monthly, which is open for disaster, and it leaves you open for being scammed because will be calling. Expect more calls or people trying to get you to change. Even if you have a prescription drug plan through a Medicare Advantage plan, they will try to get you to change your plan because they know that you can change once per month. If you change your prescription plan, if you had a Medicare Advantage plan, you will not be able to join another Advantage plan. You will just be changing prescription plans. Okay, so you'll no longer be permitted to change from a Medicare Advantage plan monthly. So just know that. Okay, they said that they sent out fact sheets and little postcards. You see in the bottom right-hand side, little postcards to explain the payment plan program that they have put in place. It is also in Medicare and You. So if you have the book, you can look at it and you can find and read it again. They have general videos that you can go on YouTube and find the videos. But just know that if you have been paying a set amount monthly and it will continue in 2025, the program may not be best for you, and you should try to stay with what you had. But if you were paying different amounts or large amounts, like $400 the first month and $300 the second month, and then therefore ongoing, then you would possibly benefit from that. Okay, Part C is the Advantage Plan, and the Advantage Plan is like the insurance you had when you were working. It bundles A, B, and D, and it has the extra benefits. So you know some of the extra benefits are the dental, vision, and hearing, and the gym membership, things that Medicare does not pay for. Medicare does not pay for vision exams, does not pay for your glasses, does not pay for routine dental. Okay. The Advantage plans are private insurance companies that have a contract with Medicare saying that that is what they will provide for the next year, $185 that they will be paid. So you pay Medicare, Medicare gives the money to the insurance company. You still have the same rights and protections. You get the same services. The insurance companies cannot charge more than Medicare will have charged for chemotherapy, dialysis, or the skilled nursing care. And you can choose a plan that does not have prescription coverage included in it because some people have other means of getting their prescriptions, like through Veterans Administration or union or some other agency. So you don't have to get an Advantage plan with prescription drug coverage. So what is the difference? Medicare is national. Wherever you go, you have it. The Advantage plans are regional. They're locked into a zip code area. And once you go out of that particular area, you are out of network, you are out of the area, and they may not pay anything. Okay, there are financial assistance programs that will help with paying for the premiums or sometimes the co-pays and deductibles. If your income is $1,275 or less, then you qualify for the state to pay for the Part A and B premiums and the co-pays, co-insurances, and deductibles. If it is 1526, it will pay for the Part B premiums only, 1715 Part B premiums only, and if you're working disabled, you can earn $5,105 and it will pay your Part A premium. This is where you would have to go. You go on Georgia Gateway, and it's the same application that you put for regular Medicaid, $973 or less. So if your income is more than that, you don't qualify, but you might qualify for one of those other two programs. And you have to put in your name, verify an email address. You don't have to do the email, but you do have to verify your phone number. This is the paper form for the QMB, SLMB, and QIW1. I would not recommend that you do the paper form at this time because not all of the offices are open, not all of the workers are there, and that means whoever you give this form to will be the receptionist. They will stamp it and they will put it somewhere until someone either comes into the office to work on it or comes in to take it back home to work on it. If you do it on the computer through the gateway system, then it is date, time, and stamped. Now, for the extra help that's through Social Security, and your income limit can be $22,590 for an individual, then it will drop your Advantage plan, prescription drug plan premiums to zero, make your deductible zero, drop your generic medications down to $4.50, and your brand name medications down to $11.20. So that is a very good thing. Now, Medicare also has innovation programs, the guide model for dementia care, cell and gene therapy, joint replacement model, a kidney care choices model, enhancing oncology model, and primary care. Okay, let me see, the guide to, okay, the guide to dementia care, that's a wonderful new program. And it reminds me a lot of hospice. Instead of just you going into the doctor and getting a diagnosis and then not remembering what was said and not knowing what to do, they're going to have a care coordination and management team. So there's going to be 2 medical personnel, you and another person with you, family member, caregiver, in that room when you get the diagnosis. And then they're going to help you coordinate with other conditions, because most people have medical conditions as well as some type of dementia. They will also help the caregiver with caregiver skills training, because there's more than one type of dementia. Not everything is Alzheimer's. And they help you understand that, have diagnosis, education, support groups, and then there'll be a personal care navigator to help you whenever there is a problem or you need some services or information. So there will be someone almost like the nursing line 24/7 to assist you. And they have set aside money, $2,500 per year, so that you can get respite care. So that would be in your home, in a facility, at a daycare center, but they have provided that. Then for the gene and therapy, oh, let me say one more thing. For the guide model for dementia, it is already at Emory, and it will be at Grady in 2025. For the gene and cell therapy, they're concentrating more so that people can be accepted or approved for the testing and the services, and they're going to really concentrate on SCD, stands for sickle cell disease. So this year, they're really going to concentrate on sickle cell disease and help individuals. Approximately 1 in 25 African Americans carry a genetic mutation that puts them at increased risk for developing an inherited, progressively debilitating heart disease. And now that you'll be able to test for that as well. Okay, I'm not going to stay on the fraud and scams because we already had the individual here, but now is the season. So there's going to be medical identity theft, hospice fraud, home health care fraud, brace fraud, and ambulance fraud. Please remember to call Senior Medicare Patrol. Department of Human Services wants you to know that SHIP is a part of the Department of Human Services, so that's part of their money, and that we help you with Medicare assistance, help you understand it, help you enroll. We can do the gateway application for you, help you with the extra help application. We're asking for volunteers, so please, and we're asking for event requests. If you want us to come out and speak at health fairs or groups. Georgia Legal Services wanted you to know that our office is in Georgia Legal Services. They have navigators that will help you with Medicare and the marketplace. These are the numbers for all of the Georgia Care offices all over the state of Georgia. If you need a SHIP assistance or person in your state and you're not in Georgia, go to shiphelp.org, and there is a locator, and you can put your state in and it will tell you the name and the phone number of the SHIP office in your state. Let me see. Some of the other, do I have enough time? Some of the other new rules are for individuals that are on bail, parole, probation, home detention, or in a halfway house. They're no longer in custody, considered in custody, and Medicare can pay for their covered services. There's going to be a special enrollment period for formerly incarcerated individuals. That is now based on the Social Security Administration's incarceration release determination. Advantage plans are not the best for everybody, so don't let someone try to persuade you into an advantage plan. Please see what it is that you need and how best Medicare will work for you, either original or the Advantage plan. The Advantage plans, there are certain plans that have left Georgia this year. So you should have gotten a letter that they left. And I know for a fact that United Healthcare GA0004 is one of the plans that left. Then there is a Aetna Medicare Signature plan that has left, and there are a couple Humana plans that have left. You should have gotten a letter. If you did get a letter, please take the time. You have a special enrollment period until December 31st, not until December 7th when the open enrollment was over, but December 31st to enroll in a new Advantage plan or a prescription drug plan. And they gave you until February 28th of 2025. If you have not enrolled in a new plan by then, you will have to wait and you will incur the late enrollment penalty for the rest of your life. And I want you to know that 44,597 persons lost their extra help this year, and that was people in Georgia. 44,000 people in Georgia lost their extra help. Please give us a call. We'll try to help you find a way to pay for your medications and for services that you need. And sometimes there was a mistake and you can reapply and get re-enrolled. And then I want you to know about the JIMO Act, JIMMO. And that is saying that you can get home health care and they can keep it longer than the usual 8 to 12 weeks that they try to keep therapy going. It is ongoing, and that's a law. And that's the law. Look it up if you need to continue the services to prevent yourself from deteriorating. It says maintain. You don't have to get better. Just maintain or slow the progression of the deterioration. JIMMO. If you have any questions, if I went over it too fast, just give me a call, 470-249-3973. Okay, now I give it back to Ms. Chapman.
Great job, you guys. Thank you, Nathan and Miss Shirley. So, yeah, first of all, I really appreciate you zooming through the presentation. It was really great. But I want to give this time where if there was a point within the presentation for Nathan or Miss Shirley and you wanted them to touch on it a little bit more, or like go back to that slide, or you have any questions, this is definitely the time. I think you should be able to raise your hand or whatever, so no one's talking over each other. And also, I did put a poll up. If you could take out the time to complete that, so I can give a better understanding of individuals that are in this meeting to provide additional information based off of the responses, I would greatly appreciate it. But yes, if you have any questions, you can either type it or you can verbalize it. All right, so I do have a question in the chat. What is the risk of you staying with traditional Medicare?
Risk? There are no risks. What happens is you need to change your prescription drug plan or at least review it every year because they change their formulary on what they will cover and that sort of thing, or they increase the cost of the premium. But there is no risk with Medicare. You just have to know if that's best for you. There's some people that take long vacations or are in Florida half the year and some other snow-bearing state in another year. Well, then you are still covered under Medicare. There was one person that I had that had a kidney disease that needed to be treated, and it was only in Tennessee. So she had to go to Tennessee every other month to get that treatment. Now, the kidney care model that I said Medicare has provided, it will be here in Georgia in 2025. So instead of having to go to Tennessee, if that is something that you need, you can look that up and find out where you can go for the treatment and services.
Awesome. Okay, and there was another question in the chat. This asking about, will this presentation be available to us to be downloaded? Yes, from my understanding, it will be on our YouTube channel. I will definitely clarify, get clarity about Albert. But also I did record it and can send it out as well. And I'll just verify with that. But yes, this will be available. Any other question? Okay, so
Sorry.
go ahead.
I'm asking for my dad, who's going to be turning 65 in March 6th, 2025. Currently he is getting like his retirement payment since he turned 62. And he is working full time. And on his like SSA website, it does say he is like enrolled under Part A. So I'm guessing they did that for him automatically since he is getting some type of social security income from them. In terms of, he is more interested in like vision, his eyesight treatments. Is there, does he need to do anything to enroll for like the other parts of Medicare to get the vision part, or will he continue to be enrolled in all of the parts automatically?
No, he will not be automatically enrolled. He was automatically enrolled in A, but he is still working. So does he have vision coverage under his employer? That's something you should check out first.
He doesn't have any insurance right
How are
now.
you?
I'm sorry,
He doesn't have any insurance right now.
Hey, how are you?
just the
I
Part
got
A?
signed in earlier.
He just noticed Part A was, he was enrolled in that
That's
like
what's the name up
last
here.
week.
They might have ripped that sheet off.
Okay.
Yeah.
Well, everybody knows about the open enrollment period in the fall, but in January 1st through March 31st is also.
Oh, Miss Thomas, you got muted.
I'm sorry.
That's okay. So January 1st through March 31st is also general enrollment period, and that's when you can enroll in Part A or B when you are not already enrolled. If you did not enroll because you when you turned 65 because you were still working, if he lost his employer coverage, but that's when you can enroll in A or B, just those 3 months. So if you miss it, then you have to wait till the following year. But that means that come January, he can get in touch with Social Security and enroll in the Part B. Has he worked the full 10 years to have the full 40 quarters?
Yes.
Okay.
But like from your presentation, you said vision specifically, that's what he's more in need of right now. And you said vision is not a part of the Part A and Part B, and it's in another one.
That is correct. It is only found under the Advantage plans. The Advantage plans include vision. Medicare will pay for your your cataract surgery and the first pair of glasses after you have the cataract surgery, but that's it. And for dental, if you need like a heart valve replacement or repair, or you need cancer surgery, or you need some other type of surgery, and dental is preventing you from being able to have that surgery, then Medicare will pay for it. Part A, if you're already in the hospital. Part B, if you're in the community. Medicare will pay for it then so that you can get the needed surgery, but that's the only time it will pay for dental. I've had someone had their teeth knocked out and saved the teeth, and they could not have them put back in because that was considered cosmetic.
Okay, so to get vision, because he is partially losing eyesight on the left. Does he so he has to call
Doctor,
the
whoever the doctor is that is seeing him for the vision, and see if there's going to be a needed surgery, implant.
There is
Awesome.
a surgery they mentioned. Like a small procedure, they said.
And I'm sorry to interrupt. Who's speaking again with the questions?
Helen?
Helen, okay. Hey, Helen, definitely appreciate these. These are
Sorry.
great questions. No, this is great. It just, I think Shirley can actually answer them more directly with you, like one-on-one.
Okay.
Give you that opportunity, because I'm sure there's like a few like different scenarios that's happening, but I definitely want you to get the information you need. So I'll put Shirley information on here again, just so
Okay.
you can have, but if that's okay with you, she can follow up, or you can follow up with her with that.
Yes, please. Okay.
Okay, awesome. I will
Thank you.
put that in chat. No big deal. President Weena, hey, good afternoon. Well, good evening. Thank you for joining. So many people on here. I did not notice that. I really appreciate it. Go ahead and ask your question, and if you would like, you can introduce yourself as well.
All right. Hello, everybody. I'm Edwina Clinton. I'm the president of the NAACP, and I'm happy to be here and was excited to hear about this presentation, but I know how big Medicare is, and you can't explain it in an hour. So I just want to warn people, whoever's 64, about to turn 65, please start studying Medicare now. It is so overwhelming. Just like she said, some dates are missing. This is my first year on it, and I'm telling you, it's too much. I'm just used to having one insurance. You pay the premium and it's over. This right here is just too much. And I've gotten almost 200 calls in this open enrollment period. And I feel sorry for us. I'm gonna have to turn my phone off to get some peace next year when they start calling about the what did she say, the Medicare? No, some will be open 3 months out the year.
Oh yeah, the general enrollment period is January through March. And because you can change your prescription plan monthly now,
Right.
if you have Medicaid or extra help, they're going to bump up the calls trying to call people. Okay.
They about drove me crazy. I mean, it was just so ridiculous getting call after call. But anyway, all I got to say is everybody needs to study that Medicare before you have to get on it. Because if you make a mistake and you get diagnosed with something terrible, then you're stuck with whatever you have.
It is. You might incur a lifetime penalty, or I was speaking with someone else this week, and they were encouraged to enroll in an Advantage plan and a Medigap. Now, you're not supposed to have both of them. So I'm pretty sure that neither of the agents knew that this person had both of them. You cannot use a Medigap with an Advantage plan. So this person has been paying for a Medigap for a whole year that could not be used.
All right.
Any
This has been great, and thank you all for this. And I'm glad I hopped on.
Thank you. Any other questions?
Yes, I have a question.
Okay.
Hello. Yeah, hi. And okay, yes, hi. Thank you for the information. These are two quick questions. So I have Medicare, and then I have the Advantage with Kaiser. And so this is something I think you cleared up. I think it's clear in my mind, but I'm still not sure. If there's something out there that Medicare offers that say Kaiser does not, I can't take advantage of it, right? Because I have the Advantage plan. Am I clear on
Kaiser,
that?
well, Kaiser is supposed to follow the same rules. So maybe the payment coverage for that particular service is different, but they have to follow the same rules. Medicare is a federal program. It has the registrars and all the manuals and everything, and the rules and regulations and things signed by the president and okay, on the shelf. So whatever they say, it has to be followed. The difference is with somebody like Kaiser, it is a private insurance company. And so they tweak it somehow on how much they're going to pay, but they cannot totally deny you for that service.
Right, because I had to get these. One thing is I had to get these injections in my eyes from diabetes, and I guess I ran up a big tab with that. I wasn't clear. They are giving me some assistance, but okay, to help with that, I think I owe them about $2,000 now, which I guess that's good. But that's the point. When I have that advantage, then I can't do anything Medicare. Just Medicare. I have to go with that because Medicare pays Kaiser. That's what you were saying, right?
Right.
Okay. And the other quick question, I've almost started to call when you see all these things on the TV where you get this and that. If you're on Medicare, you can get this shipped to you. So do you think those are like really scams or something? We should not take advantage of any of that. And I guess I wouldn't be able to because I had the Advantage plan and not just Medicare, right?
Well, those are Advantage plans, and that's a bait and switch thing. Okay, they know that people have to be low income to get most of the things that they're promising you. So people call because they think they can get it, and then they'll find out, well, no, you don't qualify because your income is too high or your assets are too high. Your income can be low, but you still have money in the bank or a certificate of deposit or something. Okay, then that's too high. And then they try to sell you something else.
I was in the front and my phone was in the back because I was charging it.
I got you. No worries. Okay, got you. Thank you.
Okay. Well, okay, so you guys, after reviewing the poll, I did, it's quite a few people that want more information about what's happening at the branch. And we have some, very excited that wants to volunteer. And also we have a few that would like to become a member. So in the chat, I put a Google form link, which is anonymous and also private. I just put it in, it says 6:30. If you can, it's just a question where it's asking for your name, your email, and our telephone number. For the individuals that want more information about things that's happening at the branch or want to become a member, join a committee or my committee specifically. Like I said, even though I know you guys did send direct messages, you definitely, if you could fill that out, that'd be great because it will generate a report to me so I can make sure I collect everyone's. Also, I want to let you know for upcoming meeting for my people that have Medicare, and there are the only insurance I want to say is you can't have Medicaid, but I was able to discuss providing free blood pressure machines to people who have Medicare, TRICARE. I'm so sorry, I do not have the list of medications because I'm still I said medications, insurance because I'm still working on it. However, what's really great about this company is the fact that it's free as long as you have those insurance, and they do online care, meaning that this blood pressure cuff is like the standard blood pressure cuff that is in, a doctor's office. And once, like, if you check your blood pressure and it's high or low or anything, it will alert the physician office. And they do follow up with you. They provide you like with an app or an online login, but everything is free. I've seen the whole setup with my own eyes, and I think this would be beneficial to the people that have this insurance, and then also just give you a way of just monitoring your blood pressure, because the blood pressure, has other determining factors in your health as well. So I am looking forward to rolling that out. I'm hoping to do that in our next meeting in January. I'm still solidifying those plans, but if you are interested in that meeting that's coming up for the free blood pressure cuff and the free monitoring by a physician, which is a Black-owned company, they're really great. Definitely please fill out that JOT form so I can make sure when I send out the email and I find out that, okay, it's a go, I can tell you the date, the time, and, you know, give you the link. And this is open to anyone. Just share with anyone. And once I have all the insurance that it covers, I will put that in the email as well, so you can know if it applies to you. But yeah, please take out the time to fill out that form. I am going to pick apart the emails that I do see that was sent to me directly. But yes, is there any additional questions?
You mentioned that you were gonna share Ms. Thomas's information for us to contact.
Yes, ma'am. Thank you
Using the
for
link.
that. All right, Miss Shirley. Because I don't have your information on. Can you put your information in the chat? Your email for people that have additional questions?
Hello.
Hello, hey.
Hey, I have a comment, not necessarily a question.
Okay.
This is my first year being a part of Part B Medicare. And it was terminated for non-payment initially because I didn't understand anything they said, anything they did. And I was going to the Social Security office almost once a week. Oh, my name is Yvette Hall. And it was so confusing and still is confusing. And I met you, Miss Shirley, probably about 3 weeks ago at the Lou Walker Center. And your information and directions to me helped me and my friend to get me some medication that I had not had since September because Medicare blocked me. But that's a personal concern. I just wanted you all to know that it is confusing and there are so many choices. And if you are not familiar, like you all keep saying, study it. But I